Have you ever wondered how our body, this beautiful chaotic mesh of bones and blood, breath, and emotions, how it works every day, it works every minute, seconds, day by day. As you smile, you sleep, you cry, you scroll through your phone endlessly. Have you ever wondered how it works? And do you know that just one single alteration in that process can drastically change how you live? Well, that's why I studied chemical pathology in university. And that's why you should also know a thing or two in chemical pathology. Chemical pathology is the Sherlock Holmes of modern medicine. Quietly investigating your blood, your urine, your tissues, and saying things that your body can't shout out loud. It is the language of your biochemistry translated into answers. Imagine your body as an orchestra, and all the various organs of the body, the brain, heart, the kidneys, and your pancreas, thyroid cells, your liver, musical instruments. And they have like a sheet for the music they play, so the music sheet. Then the sound they make, that's the instruments now, which are the organs of your body, the sounds they make are things like chemical substances like glucose and electrolyte, urea, creatinine, cholesterol, bilirubin, what have you, mentioned them. Now, if they all play together in harmony, you live well, you enjoy your, of course, in an orchestra, if all the music are playing in harmony, of course you enjoy the orchestra, right? So if all the organs in your body are playing the right notes and producing the right sounds in harmony, you live well, you enjoy your life. But if just one instrument among these numerous instruments in the orchestra goes off tune, hey, wahala. And that's how your body works. So just some alteration in one of those organs that cause big problem for you. And this is where chemical pathology comes in, because it helps us to figure out where that off-key kind of tone is coming out from. Probably why you're feeling tired, or you have high sodium, low potassium, all those kind of things. Or you see a child that faints a lot in school. Chemical pathology helps us with that. In simple terms, chemical pathology is clinical biochemistry, simply put. It's actually a branch of medicine, laboratory medicine anyway, and it's how we check for. It's a branch of laboratory medicine that deals with the analysis of body fluids to understand disease processes and organ functions, as well as metabolic states. It's even how we test for things like diabetes. You hear of blood glucose and glycated hemoglobin. It's how we check for kidney failure. You hear of creatinine and urea, or liver issues using the liver enzymes and bilirubin. Even cardiac or heart attack, we use cardiac enzymes and troponins for that, as well as hormonal deficiencies and issues, cortisol, thyroid hormones, testosterone, estrogen hormones. They are disorders. We check for them with chemical pathology. In fact, sometimes it's used to actually detect the cause of a mysterious death. Yeah, we use that. Not just by an autopsy now, we just use chemical pathology. Just by a blood test, chemical pathology, you can figure out the answers to mysterious death. So why is it so important? It's important because symptoms lie. Symptoms can deceive you. Like for instance, not all fever is always about infection, or fatigue is not necessarily because you are lazy. So chemical pathology actually sees what we can't see, and it doesn't guess. It's very precise. It tells us, bam, this is the problem. It tells us what's happening and why it's happening. And it saves lives actually, behind the scenes. Helps to unveil your body and shows where the problem is quietly. Let's say you eat rice and chicken, or jollof, or pizza, or fries and burgers, whatever your favorite meal is. That meal in your body eventually is converted to sugar, glucose. It's converted to amino acids, fatty acids, and vitamins. Now your pancreas releases something called insulin, and the insulin eventually moves the glucose to your body tissues and to your cells. So your liver takes some and stores some of the glucose, then your muscles use some of it, your brain will keep a portion. But suppose your pancreas doesn't release insulin, or suppose the insulin is there, but it doesn't work. Boom, diabetes. That's diabetes. another example. Now, your kidneys, which is like, a bean-shaped, filter in your body, helps to filter urea. If it fails in doing this, the urea will build up and that will become like protein, so like poison to your blood. And you feel tired, you feel weak, your breath may smell like ammonia, your legs may swell, your body may itch. Guess who tells us this? Chemical pathology. There are some tests we do that are important for your health. And we often take them for granted, most of us, like everybody takes them for granted. But they're important. Blood glucose, for instance, checks for diabetes, or we do a liver function test to assess the state of your liver. We do renal function test to assess the state of your kidneys. We can also do a lipid profile, to check for cholesterol and see how your heart is at risk. And of course, hormonal assays and tumor markers, what have you, name them, there are so plenty, And these tests are important because it helps us to see what is going on in those beautiful inner parts of your body. They are not just numbers, they are stories. They're saying, oh boy, your heart is under stress, or your heart is under stress, or your liver is about to fail, or your body doesn't have enough vitamin B12. People like B12 a lot. Vitamin B12. Or this or that, And so it's important because it tells us the stories of what is going on within your body. A 65-year-old farmer in Asia with sudden confusion. A teenager in South America with weight loss and constant tests. A mother in Africa who faints after delivery. Or a businessman in Europe, with crushing chest pain. Or even a child in North America, with stunted growth. Different people, different cultures, same blood, same chemistry. And the universal translator to all this, chemical pathology. Sometimes it's hilarious, like a man thinking he's possessed by spirits, and it turns out it's just thyroid stone. Other times, it's tragic, like when a child's vomiting is discovered to be as a result of inborn error of metabolism. And sometimes it's beautiful, it's poetic, like when a slightly raised tumor marker is figured out and used to prevent cancer before it spreads. It's not just about blood anymore, it's merging with genetics, artificial intelligence, and nanotechnology to predict disease. And diseases before they even happen. Personalized medicine is actually rising. But imagine that you're fine right now, everything is fine with you. Then your pancreas are checked and they say, "Ooh, you're fine now. But in the next 5 years, your pancreas might have an issue. So let's act now." So yes, chemical pathology is technical. It's about understanding pH and profiles and plasma and enzymes. But at its heart, at the base of it, it's about understanding the biochemistry of your body. So when next your doctor says, let's run some tests, don't roll your eyes and say, again, Dr. Harper. Smile. Because that test might just help to make you live longer, help you to love better, and help you to save your life, as well as saving the lives of your loved ones and your friends. So that's chemical pathology. That's what it's about.